Grateful this afternoon, someone that is a champion of healthcare matters there in the Senate and a variety of other things. He's also becoming nationally recognized by his face on CNN and other stations and networks across this country. But we are so delighted that he is moderating and actually providing leadership for this gathering this afternoon. And I thank God for just the wonderful leadership that he is providing for us here in the state of Maryland. Won't you put your hands together as we indeed have to come right now. The U.S. Senator joining Reverend Senator Cardin, Senator Chris Van Hollen. Won't you stand? Let's give this leader a great big hand as he comes.
Thank you. Thank you, Pastor Weaver. It is great to be here with all of you. Thank all of you for being here at this critical moment. Pastor Weaver, thank you not only for bringing the Word of God to your congregation on Sundays, but doing the good work you do in the community every day. So let's give it up for Pastor Weaver, because as County Executive Rashawn Baker says, he is somebody who puts into practice his words in the community. I want to thank all of you for being here at what is a critical moment in our great national debate about health care. Dr. King talked about the fierce urgency of now, and when it comes to the arc of the health care debate in the United States over many decades, we are at a critical juncture. And the question is whether we're going to go backwards or whether we will find a way as a country to go forwards. But make no mistake, this bill in the Senate, like the one in the House, would be a U-turn on the progress we've made when it comes to affordable care in the United States of America. So it is very heartening to see everybody here as we talk about, number one, the harm that legislation will do, and number two, what we can collectively do about it. And in that regard, I want to thank the Collective Empowerment Group for joining us and partnering with us in this effort. So to Pastor Buckner and to Reverend Diane Johnson, along, of course, with Pastor Weaver, let's give it up for the Collective Empowerment Group. And the word behind that organization says it all, that together, by working together, we can do good things. I'm thrilled that we were joined by County Executive Rashawn Baker. Rashawn, thank you for your leadership here in Prince George's County. And as he indicated, the new hospital is a perfect example of the Affordable Care Act at work. And I can tell you, hospitals throughout Maryland, whether in Prince George's County or the Baltimore area or rural hospitals, will be very badly hurt if the Affordable Care Act passes. So it will do great damage to the patients, and because patients will not be able to get access to affordable care by going to hospitals, a lot of these hospitals will end up spiraling downwards. And so thank you, County Executive Baker, for your leadership there. We're also joined by State Senator Doug Peters. I know he was here earlier. I want to thank him for his leadership, and Delegate Marvin Holmes, I know, is here as well. So thank you for joining us. And in a moment, it's going to be my privilege to introduce to you someone who needs no introduction here or any other place in Maryland, or for that matter, throughout this country. And I'm really pleased that we're joined today by Steny Hoyer, who will get a formal introduction in a moment. I also want to thank Corinne Jean-Pierre from MSNBC, who's going to be moderating our panel. Thank you for being such a strong voice on many of these important issues. And you're going to shortly have our members of our terrific panel will be introduced to you, as well as some individuals who are going to talk about their personal stories and their personal testament to why the Affordable Care Act and access to affordable care is so important to them. And I do believe that the stories that have been coming forth from people throughout Maryland and around the country are ultimately what will hopefully turn the hearts of many of these senators around the country. But we need, first of all, for those voices to be heard and amplified. And so we want to do it at every opportunity that we have. So for all of you who have sent in stories, Senator Cardin, Ben Cardin and I, and Steny Hoyer, we are reading those stories on the floor of the United States Senate and House of Representatives. So please, if you have a story to tell about why the access to care provided in the Affordable Care Act and the patient protections are important to you, please send those in to us. A little later today, we'll be hearing a couple of those stories directly. Now, I know Steny Hoyer has been hearing throughout this past week and many, many other weeks before that from Marylanders throughout our state who are justifiably terrified about what will happen if we pass one of these Republican proposals, the House proposal, the Senate proposal, because these so-called health care proposals are very bad for America's health. In fact, the reason I call it a so-called health proposal is they really have very little, if nothing, to do with improving health care in the United States. In fact, quite the opposite. They are really about wealth care, because at the end of the day, what these pieces of legislation do are eliminate access to affordable care to tens of millions of Americans. That's not just my conclusion. That is the conclusion of the nonpartisan professionals at the Congressional Budget Office. Now, some of our friends may not want to listen to the facts in this or other areas, but that is a very real result and catastrophic consequence of this legislation. It will deny tens of millions of Americans access to affordable care while providing, while providing a big tax cut that goes overwhelmingly to very powerful special interests and the wealthiest Americans. So just to give you an example, if you're a millionaire in the United States of America, you will get an average annual tax cut of $50,000 every year. And that's the result of taking away health care to so many other Americans. And so when people say it's reverse Robin Hood, it is. It literally is transferring huge amounts of resources from more needy and more vulnerable people to much richer and less needy people, which is why it is fitting that we're gathered here in a church, a place, or any religious place, because this is a moral issue. And I will tell you, the Senate bill and the House bill these pieces of legislation are moral monstrosities, and we need to stop them. If this was about health care, just let me ask you this. If this was about health care, why is it that not a single, not one, patient advocacy group in the United States supports this bill, right? All the organizations that are dedicated to fighting cancer or diabetes or heart disease or Alzheimer's, you name it, every one of them is against this so-called health care bill. How can that be if this is really a health care bill? The AARP, which represents older Americans, says that if you're between the age of 50 and 64, so in that age range before you qualify for Medicare, you're really going to get socked by what they call an age tax. You're going to have to pay a whole lot more for your health care. And in addition to them and the patient advocacy groups, you've got the providers, you've got the nurses, you've got the doctors, you've got the hospitals, you've got the people who are providing care. Every one of them has already come out on record against the Senate piece of legislation. So make no mistake, this is not about providing health care. It's much more about those tax breaks. Now, I want everyone to remember, think back to after that moment when the House passed their bill. In the Rose Garden at the White House, President Trump had a big celebration. They were patting each other on the back, shaking hands. You may have seen the report just the other day that behind closed doors, President Trump said the House bill was mean. It was mean. He was right behind closed doors. All that public talk, all that public happy talk about how this was great for everybody was pure nonsense. Behind closed doors, they said it was mean. And here's the thing. The Senate bill is just as mean, and in many respects, it is worse and meaner than the House bill. For example, it cuts Medicaid much more deeply than the House bill does. So the Republican leader in the Senate, Mitch McConnell, has said, after doing this, putting this bill together in secret for weeks and weeks, he says he wants to try to rush it, jam it through the United States Senate this coming week. This coming week. Which is why this is such a moment of truth for all of us in this battle. And I can assure you that we will fight this tooth and nail. Senator Cardin and I will in the Senate, and Steny Hoyer and his team will continue to fight this issue from the House. But we also need all of you. And we need all of you to reach out at this moment and in the coming days to anybody you know in any other state in the country, whether by phone, by email, by text message, Facebook, whatever means possible. It is very important that people you know call their senators from these other states and tell them to do the right thing by their constituents and not simply take the orders of Mitch McConnell and the Republican leadership. There are 52 Republican senators. We need three of them to join us in this effort. We need 3 of them to listen to their constituents and do the right thing by their constituents. And we need all of you to help us be force multipliers, because I can tell you, as we speak, senators are getting calls in their offices. They are going to their places in their states, and it's really important that their constituents in those states be showing up and calling and letting them know what they think. All of you who've been following the news on this, and there are a number of these senators who right now are in the process of making up their minds. And yes, it's true, Senator Cardin and I are already clearly in the fight to stop this, but all of you can help. The nurses' organizations in Maryland are calling their counterparts in every part of the country. And every one of us can have that role to play, and don't think it doesn't count, because this thing can come down, and it will likely come down to 1 vote in the United States Senate. So that's why it was so important that we all come together, help make sure you get the facts and information, so you can understand the harm this bill will do to health care in the United States of America. And together in the coming week and weeks, we need to make sure that we stop this effort to turn back the clock so we can get back to the effort of actually improving health care. We all know it's not perfect now. We all know we have a long way to go. But step 1 to moving forward is make sure we don't turn back the clock in the coming weeks. So thank all of you for being here. And now I want to introduce somebody who's been a leader in this fight in the House of Representatives. At the end of the day, the House passed this by the minimum votes necessary, but they did pass it, which is why the Senate vote is going to be so important. But on the front lines in that debate has been somebody who we know very well in Prince George's County and Maryland, and someone who's known as a leader throughout the United States, our good friend Steny Hoyer. Steny?